Theresa May has taken on critics of the Conservatives' record on public services with a highly personal speech about her own experience. In an address to the Conservative Spring Forum today, the Prime Minister admitted that public services face real challenges, but insists the government cares deeply about their success. In central London, we're joined by Dr. Bob Gill, a GP and NHS campaigner. Mr. Gill, thanks for your time. Theresa May says she's eternally grateful to the NHS, and we know how much we care about our vital public services, and we know we have a strong record of delivery in government. What did you make of her speech today?
Well, it was difficult to comprehend. It seems that Theresa May is completely out of touch with reality. We hear on every news broadcast you see about the NHS on, how much it's struggling. I work as a GP in the NHS. My patients are struggling to get seen at hospital. They're having appointments cancelled. The NHS has suffered its worst winter crisis in living memory. We know that 100,000 people have died since the austerity programme that the coalition started and this government has continued. So there are serious questions for this government to answer. But I have no expectation that they will give us an honest answer, because the defunding of the NHS, the deliberate withholding of funds, is essential because they want to destroy the trust in the NHS, because they're lining it up for privatisation.
Is that right? Because the analysis of the Department of Health's published accounts shows that the share of spending by NHS commissioners on the private sector was 7.7% of the total budget last year.
Yeah, well, this is a very selective analysis. They haven't counted in the cost of private finance initiative burden. They certainly haven't calculated the cost of the market, which is in excess of 10% of the whole budget.
The blame for PFI lies with multiple governments of both hues, though, doesn't it?
I agree. There's been a 30-year stealth privatisation. PFI has saddled the NHS with huge debts. That's diverting money away from patient care. The internal market, the market bureaucracy that has been imposed on the NHS, is also diverting tens of billions away from patient care. So patients, staff are struggling whilst money is being siphoned away to banks, financiers, and in due course the insurance industry.
So when Theresa May, you did say in your first answer there, you effectively think she's being a bit disingenuous, but she does say in her speech today that they have to recognise that there are problems, and she's, quote, "We need to be unafraid to speak out clearly and passionately about our values as Conservatives and what motivates us in politics, but we have to realise public services do face real challenges." She is acknowledging that there are problems.
Well, it's like the doctor who can give you the right diagnosis and give you the wrong treatment. She is being completely disingenuous. The strategy of the government now is to deny, carry on the privatisation, keep pulling the wool over the public's eyes. She talks about the democratic will, but nobody's voted for privatising the NHS. She talks about public trust. No sensible person can be trusting anything that's coming out of this government. She talks about the public interest and British values. Well, it's not in the public interest to convert to an American-style insurance system.
No one is suggesting that's happening. Again, I'll show you the King's Fund's view on this. Following the Health and Social Care Act back in 2012, little evidence of a significant increase in spending on private providers. In many cases, the use of providers that are private to treat patients reflects operational challenges. There's no suggestion there is an American-style healthcare system coming anytime soon.
There won't be any suggestion from official sources or these supposedly independent think tanks. If you look at the Health and Social Care Act, the legislation in 2012 that sets up for an insurance-based system, it creates clinical commissioning groups, which are state-funded insurance pools, which are ready to be transferred over to the private sector. So if you understand health policy, if you understand the legislation, it's clear, but not enough people understand what this government has done, and the secret to their deception is the stealth and the complexity of what they've done.
Dr. Bob Gill, thank you for your time.